Hello everyone, my name is Dr. Bryan Davis. I'm a clinical health psychologist here at the Norton Neuroscience Institute. Today I'm going to be presenting a topic titled Men and Masculinity and the Intersection of Managing MS. I have a background in this specific topic where I did my dissertation research looking at masculinity development in men from different cultures to add more context around gender norms and how they intersect with Western culture. I blended that when I started to work within health psychology and specifically within the MS community. I noticed within the research that there was a pretty big void in terms of research looking at interventions for men just overall, but also with men specifically managing MS. Then with my question, looking at the history of gender norms and the power of social and the overall power of those socialized gender norms, I wondered if this could play a role in how men manage chronic disease, specifically something like MS. I had an idea that it would be really hard to do, so if men rigidly adhere to specific gender norms that are reinforced by our culture, how managing a disease that may be debilitating may be very challenging. A lot of different aspects can contradict a lot of those gender norms within MS, and I imagine that this may play a role within the overall coping and overall quality of life. That's specifically what I looked into with my research that I actually presented at the Consortium of Multiple Sclerosis Centers in 2020. The title of my research was The Conformity of Masculine Norms and the Effects on Coping, Health Behaviors, and the Quality of Life with Men Who Have Multiple Sclerosis. This is a topic that I want to touch more on today and provide more background and education around. Specifically, what I wanted to do is explore how males are socialized and looking to socialized gender norms and the power those have in our performance as well as our behaviors throughout our lives. I also wanted to discuss the process of masculinity development as well as discuss the intersection with all those things as kind of a foundation and how that intersects with MS symptom management. When you think about the socialization of masculinity, this doesn't happen truly in isolation from one aspect. It really comes from a few different places, most of them external within our environment that really model for us how to be men. This can come from family, come from friends, come from popular culture. I think all these things influence each other. Popular culture influences families, families influence our friends, friends influence what's actually popular, and that's what we are really living in, and what makes it a very powerful model for us as we continue to develop. So from a young age, we really notice what's being reinforced and what's being positively appraised. We learn how we ought to be and how we ought to behave based on how the world around us functions and how we can measure for this. This is one of the inventories that I use for my specific research, where we can look at specific gender norms, and there are many more, but this is just one example of some of the gender norms within specific inventories and how we can measure this within men and look at within research. Why we actually measure for this is because research has found that specific gender norms can influence health behaviors in men. Certain gender norms can influence a lot of other factors in terms of mental health, personal health, etc. Therefore, adherence levels can be predictive of other things. Just in general, you're looking at some of these gender roles, we can see a common thread of some of the traditional masculinity ideology that is maybe being emotionally restrictive, being independent, being strong, both physically and emotionally, being maybe a risk taker, and really being a go-getter. All these factors at play are not in one inherently bad things. I think that's one of the things that we get confused about is when we look at masculinity research, we get in this, if someone adheres to traditional gender norms, then that's not good. And really it's more of a nuanced view than that. And that's what a lot of the more recent research has found is it's more looking at the rigidity as the issue rather than really what they're adhering to. When we think about the rigidity, this is a nice kind of figure that I like. This is what's used by an author. His name is Michael Porter. It's called the man box, and it's relatively straightforward. But I think it explains things really well. What happens is all these gender norms that are inside are truly positively reinforced by friends, by popular culture, by family. And what happens is it kind of keeps us in this rigid box and how we're allowed to be and how we're allowed to behave and what we're supposed to do. Society and all those environmental factors keep us in there because we know that if we don't fit in this box, if we go outside of this, there's a consequence to that. There's name calling, there's ridicule. A lot of those things are very powerful and keep us kind of behaving in this rigid way. What research has shown is that this actually causes strain. It's actually called the gender role strain paradigm, and it looks at the relational, psychological, and emotional cost in adhering to socialized gender norms. There's a couple of areas here specifically, and one is called discrepancy strain. If we look at previous slides and all of these socialized gender norms, and there's a lot of them, and it's actually unrealistic to adhere to all of these at once. For example, how can one be emotionally restrictive while at the same time being assertive? So when we're not able to fulfill all of these things, a discrepancy builds between realistic and ideal. We tend to internalize that discrepancy between actuality and ideal circumstances. Truly, this is like a dog chasing its tail. It's never really quite going to catch it, and we pay the price in terms of internalized guilt. The other is dysfunction strain. This is looking at someone who was actually checking most of the gender norms in terms of adhering. And this may be positively reinforced by friends and by family and with popular culture, but realistically, there's a cost to adhering to this so well. That comes in either specific health behaviors or maybe relational concerns. For example, if we're rigidly emotionally restrictive and independent, maybe we don't go to the doctor all that often, or we don't listen to our treatment plan and maybe practice risky health behaviors. You can see how there is dysfunction to overly adhering to some of these gender norms. And I want to emphasize too, doing so in a very rigid way. That's where we see some of the concerns. This is something that we can see across literature in men with health conditions. It's no coincidence that a lot of it is from men really doing their best to adhere to something that's reinforced by the world around them. In terms of gender role strain, we're often doing more than one thing. There can be strain within all of these different areas, being a partner, being a friend, being a worker, being a parent, all these things that we are, all these hats that we wear. You can see how this isn't just an isolated incident in one area, but this really touches everything that we do. And then these things interact with each other, and it really does come at a cost for individual males when we have to rigidly adhere to some of these gender norms that maybe don't work in every single scenario that we are in. And speaking from a foundational perspective here, this is between the conflict and the strain and the difficulty in the rigidity of socialized gender norms. That's just the foundation. And when we add in something like MS, where it can be really hard to manage a disease that's taking away our ability to perform gender in a way that we're used to, this can play a role in psychological factors such as anxiety or depression, stress, self-blame, negativity. I think the whole point here is that rigidity towards the gender norms do not serve us well when we have to be flexible, potentially, in what things are going to look like moving forward and how we're going to maybe have to do things moving forward. If we're used to doing it in that one way, then that's the only way that it can be done. It can make it really hard to adjust. If you look at something like discrepancy strain within MS, for someone that values being physically strong, being the provider, being emotionally restrictive or stoic, being independent, well, you can imagine how someone facing symptoms related to MS can really throw a wrench in a lot of those values in terms of how we're performing those. I think when we rigidly have this idea of physical strength and rigidly looking at how we are as a provider, maybe that's only a monetary way of performing that. We can see how MS can really make it difficult to perform some of these gender roles, especially if we're adhering to them in an overly rigid way. If we look at this from a view of dysfunction strain, this can play a role back to overall health behaviors. If maybe we're not going to the office visits to see our provider, maybe we're going to try to tough this out, or if they want to make us take all these medications or do this whole treatment plan. And we're just not going to do that because we can get through this whole situation ourselves. And again, taking risks. Maybe we need some assistance in walking. Well, we don't want that assistance. We want to go do the thing and go do the tasks that we're used to doing, like maybe yard work or going to work 5 days a week or working full time. Well, all that can have negative consequences in terms of our overall health, and it's coming from the premise of sticking with these rigid gender norms. That's really the foundation to where we potentially can see a lot of challenges in men coping and adjusting to MS. Then what happens is we can then stop doing things that matter to us. If I can't do it the way that I want to do it or the way that I'm used to doing it, if I can't do it that one way, well, then I'm just not going to do it at all. That's coming from a lens of rigidity. That's an all or nothing approach, and I think that that's a viewpoint that's really surrounded by us in our society. this dichotomy in society that we live in, this yes, no, hot, cold, on, off, we can bring that onto ourselves in terms of our overall functioning, to where if we're not doing things the way that we want to do them or think we can do it, well, then we're just not going to do it at all. Then we see men that aren't socializing, that aren't being active, and aren't doing the things that they value because they can't, and it maybe doesn't look the same. And what can we do about this? I think that, again, what I found was that this topic was not really being explored in the literature, and especially clinically within men managing MS. What I wanted to do is understand why, and I think some of it can be that maybe prevalence rates are lower in men, and maybe it can also be that men not bringing up this issue, and then providers not looking for the issue either. I think of men even talking about this is a complete contradiction to their gender norms, for them to say, hey, I'm concerned here, or hey, I'm really struggling with this, or hey, I could use some assistance in a specific area. That's completely in contradiction with their traditional gender norms. It makes sense into why maybe this isn't being looked at, and it takes conversations and presentations and these types of things to really get that ball rolling in a different direction. Basically, this doesn't have to look at only using inventories or measuring tools, but it can also be done using clinical conversations. I think when providers have the sense of gender roles and how they could be affecting how a man with MS is adjusting to his disease, or is adhering or not adhering to a treatment plan, when we speak to these gender roles, and the power of this is giving men the space, and it's okay to talk about this, and we're able to build a strong rapport with one's provider, and increase trust and increase openness. I think when you're able to do this, it really opens the door for opportunities for future intervention and a nice collaborative conversation in terms of what's going to be best. I think when you can do that and normalize the male's experience, this really validates them and really goes a long way. For spaces that have the opportunity, I think we're doing this here at Norton, as well as some areas that I've worked previously. I'm hoping that we can provide a referral for health psychology or social work, because what we want to do is continue to build these psychological services and emotional support for men. That's something that we can do via individual work as well as group support. Here at Norton, I see men individually. I also have a men's support group. This is something that we truly want to provide in terms of services, and we want to further conceptualize and have our providers see some of these topics too. And that's what we're doing here. What we do in terms of intervention, really what we're doing is we're taking the rigidity that we've talked about, and the rigidity of looking at oneself and how we perform our gender, and the rigidity to the traditional gender norms, and we're just adding flexibility to that. We're not saying, hey, stop doing the things you're doing, or this has to look completely different. We're collaborating with the individual on how they can participate and do their own valued behavior in a way that doesn't necessarily look the same, but it doesn't mean that they can't do. I think when we lift the rigidity and the limitation of how we define some of these roles, being a provider or being strong or being all of these things, we open the door to how else we can define that, and giving them, not the society, the opportunity to define that, but actually the individual man to define what that looks like, and then develop a way for them to engage in that, and again, doing that in a workable way. And you see that. My two favorite words are flexibility and workability. I think when we're able to increase these things, increase these value-based behaviors in a workable way, and we increase flexibility in how we're looking at how we perform our gender, it really gets us back to living our life in a way that's helpful, in a way that's more in line with how we view ourselves and how we want to be, not only for us, but for those around us. I want to thank you all for listening to my presentation. I think it's a topic that we're going to continue to talk about here at the Norton Neuroscience Institute and continue to provide services for. I look forward to speaking more about this and providing care for our men managing MS.